Hi everyone, this is Nick Despotidis, and I have the privilege of being joined by Paul Levine, co-president of our academy. Paul, thanks so much for joining us.
Thanks for having me, Nick. This is a great opportunity to, speak with our members about some of their questions, and I really appreciate your time and inviting me to help out.
Yeah, I appreciate your insight as well. This question comes from Nathan and Nate Bonilla Warford. I've known Nate for a number of years. We addressed this question somewhat in an earlier episode, but I thought I'd give Nate the respect of letting him ask his questions, and we'll reiterate our thoughts on this. So I'm just going to play an audio file from Nate.
This is Nathan Bonilla Warford from Tampa, Florida. Thanks for taking my question, Nick. I'd like to know how you proactively deal with ortho-K patients who want to come in for their comprehensive eye exam but do not want an ortho-K evaluation, but they want to continue wearing their ortho-K lenses. Thanks for your time.
Thank you, Nate. Paul, do you want to start on this one? How do you handle people that, go ahead.
Well, I mean, the way Nate phrases that question is interesting. It's sort of like it almost sounds like the patient is driving the bus here. Yeah, they want to keep doing it, but no, they don't want to have the evaluation. I mean, I don't understand how you can sort of have it that way. So I think right from the outset, that's an expectation that they should be, they should be given at the time of entry into the program. But as far as whether it's a matter of just not showing up for the appointments, I mean, one of the things that we do for pretty much most of our patients, but certainly all of our ortho-K patients, is we pre-appoint everything. I mean, They never walk out of the office without having their next appointment in hand. And I'm sure most of us do that. And then, of course, we also use, we're currently using Solution Reach in our practice. We've used Web System 3. They all have their pros and cons. But this sends out the emails and the text reminders, and then as an incentive for them to stay current with us, our maintenance program patients, which is really all of them, those that are keeping up their end of the bargain, if you will, when they do need new molds, we do discount them a little bit, off the full amount that we normally charge. But to be honest with you, our prices are kind of set to reflect that 20%, because pretty much all of our patients are really good about staying on maintenance.
Yeah, I can empathize with Nate. We have the opposite problem. I know what's going on in his office. They show up, they just want what's covered for their insurance. I bet you that's what's happening here. And because I get the opposite. They show up at our front desk. They want the ortho-K evaluation, but they can go to their VSP, IMED, whatever the case may be, provider, and get their comprehensive eye examination somewhere else. So Nate, I've had this similar situation. You got to nip it at the bud beforehand. Like Paul said, we use Web System 3, we recall them, but about 6 weeks out, we prepare them saying, listen, when you come in, you're going to have a comprehensive eye exam that costs X, and an ortho-K evaluation which costs X. And then we offer them the service agreement where we lump in the comprehensive eye exam. We give them an incentive before they come in. If they fax this form back to us or send it back, we send either, I think, a $10 Target gift card. They get to choose a gas card, Target card. I'm not sure, Walmart. My staff changes it up. It's very pretty, and that has worked like a charm, Nate, where they make a decision well before my front desk, so I don't have that confrontation, whether they're going to have one or the other. So if they come in and say, I just want the exam, let's say, I don't want the ortho-K check, I don't want that confrontation, I'll speak to them in the exam room, I'll do the exam in your case. They may pay for the exam, and then I turn and I said, I didn't check the lenses in the eye because let me tell you why, and I educate them. If at that point they're still steadfast on that they don't need it, we say, listen, this is required to stay in the program. You don't have to do it now, but you have to do it before you come back. And we have them sign a little form. It's about 3 inches by 5 inches. I guess my staff cuts up 3 pieces of paper. They sign it that if they're going to come back to us, they need to get checked. If they say I'm going to go to Dr. Levine for my comprehensive eye examination, I said, that's great. Dr. Levine is wonderful. But what I would like to do is I want to send Dr. Levine a letter. And what I do is I say, dear Dr. Levine, I'd like to introduce my patient XYZ. They're under my care for corneal reshaping. They're overdue for their retinal examination. I don't want them to go there and just get a basic eye exam and say that they're a half a diopter undercorrected. This way I do two things. I'm bonding with the optometrist or the ophthalmologist. I'm hopeful. And number two, the parents know I'm not trying to squeeze them. But Paul starts, you know, I used to get this confrontation in the reception area all the time. We don't get it. Paul says you have to really take control, and I agree. The only way we could do that in our office is start that process weeks in advance. So the confrontation or the conflict, whatever you want to call it, occurs over the phone, not at your front desk. Number two, Nate, if you're still examining all these vision plans that the patients want to be covered, I think I'd like you to reevaluate it to make sure that this is the way you want to go. Evaluate if you're getting reimbursed for your chair costs, because I'm thinking that's where this conflict is happening. I just want what's covered. I don't want to pay anything out of pocket, and that's a game that's very hard to play on a yearly basis. So that's how I would answer your question, Nate. I think it's a great one. And again, if you have any questions, both Paul and I will be at this year's Academy. I hope we get to say hello and talk about it further. Thank you.
Great.